Association for the honor of the podium this afternoon. Today we'll be discussing the role of microRNAs in radiation sensitivity in rectal cancer. Our disclosures. Chemoradiotherapy response is an independent predictor of improved oncological outcomes in locally advanced rectal cancer, demonstrating the importance of understanding this patient cohort. Currently, several tumor intrinsic factors govern the response to radiation therapy, including microRNAs or miRs. miRs are small strands of RNA. These strands bind to messenger RNA and modify gene expression profiles. The decrease in protein expression is associated with mRNA degradation and translational repression. MicroRNAs are therefore closely and likely associated with the response to cancers to radiation therapy. MicroRNAs are closely associated with tumorigenesis and radiation sensitivity in multiple studies. Currently, there are 150 clinical trials ongoing utilizing microRNAs in their studies. Only 11 of these are utilizing these microRNAs in radiation sensitivity, and only 7 are using them to understand their effects in colorectal cancer. Multiple smaller studies have postulated the roles of microRNAs in disease prediction, as well as targeted therapies. Therefore, much attention is needed in this quickly evolving field. We sought to identify a miR signature in samples of rectal cancer patient specimens to identify a profile that may predict radiation response. We hypothesized that specific miRs would be differentially expressed between non-responders and partial responders. We aim to validate this profile in a subset of patients who are non-partial and complete responders. Then, we hope to identify downstream targets of these miRs that could be exploited with potential neoadjuvant therapies. We began with a miR profile generated from 12 formalin-fixed, paraffin-embedded pre-treatment rectal cancer biopsy specimens. These were identified in non-responders and partial responders. miRs significantly down and upregulated were identified. miR451A was one of the most upregulated miRs by this technology. miR451A has demonstrated prior significance in colorectal studies, and therefore the focus of our research was at this miR. We previously studied the upregulation of miR451A in a mouse model. We implanted 3 colorectal cancer cell line xenografts into nude mice. After the tumors reached a specific volume, we treated the mice with a single 2-grade dose fraction of radiation. Tumors were then harvested at various time points, and RNA was extracted to generate a microRNA profile. The microRNAs that were upregulated and downregulated were validated in PCR, and we identified that microRNA 451A, demonstrated in yellow, was significantly upregulated when compared to the other microRNAs, suggesting it is closely associated with the response to radiation treatment. To better understand the interaction of radiation and miR451A, we examined gain and loss of functions in miR451A in the cell culture. There was a significant decrease in cell proliferation when cells were transfected with a mimic 451A, while there was a significant increase in cell proliferation when transfected with an anti-miR451A, as demonstrated on your right. From our cell culture and our mouse models, we've identified the role of miR451A as a potential tumor suppressor and closely associated with radiation sensitivity. But how does this apply to our patients? To test our original hypothesis, we returned to our 45 original rectal cancer patient specimens from 2000 to 2016. These patients either had a complete, partial, or no response to radiation based on a tumor regression score. Our population was well distributed across age and gender. We then isolated RNA from post-treatment tissue and plasma and completed PCR validation. In our quantification of miR451A in post-treatment surgical specimens, we identified an increase in the partial responders. In our analysis of patient-matched post-treatment plasma, miR-41A expression was significantly increased in our complete responders, suggesting it may be used as a predictor to radiation response in the pre-treatment setting. To further understand the function of miR-41A, 8 target prediction programs were assessed using MIRWalk, and multiple target genes were found in this program. Those that were closely involved in colorectal cancer and radiation were studied. This was CAB39 and MZ. This relationship was first validated in cell culture. CAB39 has previously shown importance and connection to miR-41A in human gliomas. This protein is thought to influence metabolic adaptation and cell proliferation. MZ is a transcriptional repressor closely associated with BRCA2, which leads to chromosomal instability and may significantly impact the radiation response of cancers. Both enzymes are linked to worse survival in colorectal cancer patients based on the Cancer Genome Atlas. Measurement of these genes in our patient samples demonstrated CAB39 and MZ were upregulated in the non-responders, suggesting these proteins may be targeted with neoadjuvant therapies in individuals to restore radiosensitivity. Thus far, we have proposed a decrease in miR-41A leads to an increase in CAB39 and MZ expression, which is likely observed in our non-responders. Returning to the TCGA, we wanted to better understand the molecular characteristics of CAB39 and MZ. We identified that phosphorylation of SHP2 and RAF were significantly increased in those individuals with increased CAB39 and MZ expression. Both SHP2 and RAF are involved in cell proliferation. SHP2 is a tyrosine phosphatase involved in the RAS-RAF signaling pathway. Activating mutations of SHP2 have been associated in multiple cancers, including lung and breast cancers. Inhibitors of SHP2, which are novel drug therapies, we have found that they suppress tumor cell growth by targeting enzymes upstream in the RAF pathway. BRAF, an enzyme well known in the RAF family, when activated results in downstream activation of the RAS-RAF pathway, which stimulates growth-promoting gene products. Although trials of RAF inhibitors have demonstrated tumor resistance, recent work on pan-RAF inhibitors in the colorectal cancer model have demonstrated improved anti-tumor activity, providing some hope for this drug. We believe by some mechanism, CAB39 and MZ are upstream proteins of the RAS-RAF pathway, as demonstrated in this graphic. Therefore, we postulated the introduction of a SHP2 inhibitor and a RAF inhibitor could neutralize the effect of increased expression of CAB39 and MZ, which is associated with the decrease in miR-41A in non-responders. Let's return to a previous slide for just a moment as a reminder of the effect of anti-miR-41A transfection in the cell culture. We found that there was an increase in cell proliferation despite radiation therapy. But we believe by the introduction of SHP2 and RAF inhibitors, we can restore the effect of radiation therapy. To better study this, we transfected anti-miR-41A in the cell culture. We performed dose response curves for SHP2 and RAF inhibitors, and then treated the cells appropriately. We found that cells transfected with the anti-miR-41A had a higher proliferation, as demonstrated in the blue. When treated with SHP2 inhibitors, we found this proliferation decreased. And when treated with RAF inhibitors, we found that proliferation also decreased. Most importantly, with the combination of both SHP2 and RAF inhibitors, we found a significant decrease in cell proliferation. Ongoing studies are attempting to understand the role of radiation in this model. Therefore, we propose miR-41 expression in tumor and blood may be used as a predictive marker for radiation response in rectal cancer patients. In patients with decreased miR-41A expression, we anticipate a reduced radiation response and increased expression of CAB39 and MZ. By unknown pathways, the introduction of SHP2 and RAF inhibitors will restore the radiosensitivity in this patient cohort. context, we believe the differential expression of MIRS regulates rectal cancer radiation sensitivity. MIRS may be promising tissue and serological predictors of radiation therapy response. Finally, manipulation of their downstream targets with neoadjuvant therapies may restore their radiosensitivity. Future work is needed. Prospective tissue and plasma collection in the pre-treatment and post-treatment setting is required, as well as normal rectal tissue collection. Additional studies will clarify the role of CAB39 and ENZI with SHP2 and RAF inhibitors. And a phase 1 trial should be anticipated to understand the sensitivities of SHP2 and RAF. I'd like to take this time to acknowledge the mentorships of Drs. Liana Sikidis and Sue Anand throughout this project, as well as the mentorships of Dr. Hunter, Azro, Brazel, Martindale, and Devnese throughout my residency. Thank you.